Kia ora koutou katoa. Good afternoon. As you can see, I'm joined by Deputy Prime Minister Grant Robertson, who will shortly outline the economic support in place as we transition into the new COVID protection system, one where at every state all businesses are able to remain open and to operate. But first I'll give a short update on the Omicron situation before moving to decisions by Cabinet on the different parts of the traffic light system that the country will move into on Friday. At this stage, we have no cases of the Omicron variant in New Zealand, but the developing global situation shows us why our approach of ongoing caution at the border is needed. Over the weekend, we took immediate steps to designate 9 countries as very high risk, restricting the people who can travel to New Zealand to citizens only, and requiring them to stay in MIQ for the full 14 days and undergo 5 tests over that time. Omicron is a reminder of why we need a response that lasts and carries us through this pandemic. Some countries have had to close borders or stand up quarantine facilities again. We already had a strong system in place and the ability to move swiftly to make it stronger still. This is a reminder of the risk that still exists at our border. We are not powerless, though. There is a lot of evidence that needs to be gathered yet before we'll know the full impact of this variant. Already you can see that the international community is working closely and quickly to determine what risk this variant poses. It may impact on our vaccines, but it may not. It may be more severe, or it may be more mild than Delta. We simply do not know yet. So the most important thing we can do is, firstly, use our border system to try and stop cases from entering the community, and we're doing that. Use public health settings as an extra layer of protection, which is exactly what the COVID protection framework does. And finally, keep vaccinating. To that end, Omicron has not changed the advice on boosters, which are now available to anyone 6 months or more past their second dose. To keep it simple, boosters are available to everyone, but we're especially keen to see our border and health workers receiving this additional protection and those who may be more vulnerable, like our over 65-year-olds. I encourage you to book today or visit one of our many vaccination sites. Now to today's Cabinet decisions. This week we begin the transition into a new and safer way of operating, and we can do so with confidence. That's because we've come through the past 2 years of COVID in better shape than many other places in the world. We have had amongst the lowest case rates, hospitalisations and death rates in the OECD. Where many other places saw their life expectancy shortened, ours is amongst 3 where it has increased. As we head into the next phase, we do so with amongst the highest vaccination levels against COVID-19 too. The past 3 months have been hard though. The hardest perhaps we've faced in the pandemic so far, but the sacrifice of so many has had an enormous impact. We've avoided the exponential increase of cases that we saw in Sydney and Melbourne. We have dramatically increased vaccination rates, and we've done so with good spread across the country. But that does not mean it's time to lift all restrictions as some countries have. We want to implement a system that will serve us well and last the distance. The alert levels did that for 20 months. Now it's time for the COVID protection framework, or the traffic lights, to do the heavy lifting. This new system does not represent a considerable loosening of protections. What it does mean is using everything we have learned so far and the tools we know make a difference. It's careful and it's cautious, but it also gives greater certainty to businesses. So let's come then to where each district will move to as we kick off this new way of doing things. Vaccination rates are one of the key factors we considered when setting a region's colour in the new traffic light system. But we also considered the following: capacity of the health and disability system in a region, testing, contact tracing and case management capabilities, transmission of COVID-19 within the community, the number of cases in regions and how they're spreading, and the impact the virus might have on vulnerable populations. As we step into the framework for the first time, the way we use this criteria has been different to the way that we will apply it in the future. We have been cautious, and that's because we want to carefully transition without seeing cases take off. And so today, having weighed these factors up, I can confirm the following regions will move in at red this Friday: Northland, Auckland, Taupo and Rotorua Lakes districts, Kawerau, Whakatane and Oporaki districts, Gisborne district, Wairoa district, Rangitikei, Whanganui and Ruapehu districts. The rest of the North Island will move in at orange. The whole of the South Island will also move in at orange. These settings will be in place for the next 2 weeks. Cabinet will review settings again and provide an update before the summer break on Monday, the 13th of December. We'll then hold for roughly a month to allow us to see the impact of the shift and allow the settings to bed in. They'll then be reviewed again in the week of Monday, the 17th of January. From there, we'll get into a regular routine of reviewing settings on a fortnightly basis. With this initial designation, a key consideration has been vaccination levels. All of the districts listed today have done an amazing job reaching into their communities, but still have double dose rates in the 70% range for the eligible population. We know the higher the vaccination levels, the greater protection. Our hope is that we will continue to see a lift in rates over the next fortnight when we come to consider settings again in a few weeks. But now that we've set where districts will enter, what do they each mean? There are 3 key things to remember at every colour setting. 1, download your vaccine pass and have it ready to use so you can keep going to your favourite places. 2, take your mask wherever you go and be ready to wear it. And 3, just like before, scan in wherever you go. So it's mask, scan and pass. At orange, the big change here for parts of the country that will enter into this setting is that for the vaccinated and where vaccine passes are used, there are no gathering limits. People can gather again safely. At red, it will feel a lot like level 2. Your vaccine pass lets you go everywhere, but number limits of 100 will apply to most activities. And importantly, because I know this is a question many Aucklanders have, you can now see family and friends again in their homes and use the bathroom inside. Luxury. If you are unvaccinated, you can gather with others, but the gathering limits are lower across each of the levels. So as you can see, for the vast majority of New Zealanders with your My Vaccine Pass, life will feel a lot like it did before. For the unvaccinated, it will be more restricted. That is the best way that we can ensure that the unvaccinated are protected too. For more general information on the framework, head to the Unite Against COVID-19 website at covid19.govt.nz. Advice for Business is live on business.govt.nz. We also want to make sure that we answer any question that business may have as quickly as we can. Please, if you have a question, do call 0800 424 946. Having a vaccine pass is key under the framework, so if you haven't got yours yet, go to mycovidrecord.health.nz or you can phone 0800 222 478 to request a physical copy. We know that there are some who don't have the ability to access their pass online. If you or anyone you know needs support, you can, as well as calling the 0800 number, also visit a pharmacy that is currently offering vaccines. These same pharmacies will be able to print out your COVID pass for you. Finally, as we enter this next phase in our response to COVID, I want to say thank you. Every New Zealander has played a part in our world-leading response. A year and a half ago, as we moved out of our first lockdown, I liken that point in our COVID journey as being halfway down Everest, knowing we had to keep moving safely through a perilous descent. And it has been perilous. After a sustained period of being open, the Delta variant finally arrived. No country it has entered has been able to get rid of it so far, and it now accounts for 99.7% of all cases worldwide. And so while it hasn't been possible to eliminate Delta this time, New Zealand did something truly remarkable in managing to keep Delta suppressed while we got our population vaccinated, getting 2.2 million people vaccinated in just the past 100 days. There are 160,889 Kiwis now due for a second dose. If everyone got it this week, we would be at 89.3% fully vaccinated. That would be remarkable and such a gift to the team of 5 million. And so finally, as we enter the next phase, the same thing that was important 2 years ago remains so still. Please be kind. Be kind to yourself. It's been a hard and stressful year. Be kind to each other. Everyone, and I mean everyone, is doing their best. There will be challenges ahead. We'll continue to see cases and in places we haven't so far, but we will get through, just like we did last time, and just like we will this time, together. Look, I will now hand over to Minister Robertson, who will make announcements relating to economic support during this next phase.
Thank you, Prime Minister. Ngā mihi nui ki koutou katoa. Firstly, I want to acknowledge that this outbreak has been hard on businesses and workers around the country, and in particular in Auckland, Waikato and Northland. Operating with the restrictions in place under the alert level system has been tough, but those restrictions have helped keep the outbreak under control, and I want to thank everyone for their support in this. The government has provided more than $6 billion of support to businesses since the 17th of August through the wage subsidy and resurgence support payments. As we move into the new traffic light system, almost all businesses will now be able to operate, but the government is aware that some support may still be needed as we transition into that framework. That's why Cabinet has agreed to a new transition payment for affected businesses, which will be mostly those in Auckland, Waikato and Northland. The one-off transition payment will be activated through the resurgence support payment system using the same criteria and will be available from December the 10th. The period to assess affected revenue will be between the 3rd of October and the 9th of November 2021. This covers a period when Northland, Auckland and Waikato were all on alert level 3 at various points. The payment is at a higher per business rate than the current RSP, which will be $4,000, plus $400 per FTE, up to a maximum of 50 FTEs, and therefore a maximum payment of $24,000. The Treasury has estimated that the likely total cost of this payment will be between $350 and $490 million. As I said last month when we announced the framework, we are moving away from the broad-based economic supports such as the wage subsidy scheme and the resurgence support payment that have been provided under the alert level system. This is because at all levels of the new framework, most businesses will be able to operate. It is worth noting that this transition payment is in addition to the final wage subsidy and resurgence support payments, which opened for application on Friday. These will continue to be open for application and will still pay out even though we are moving to the new framework and even though a small amount of the period for the revenue drop for them will be under the new framework. As we move through the transition period, we will monitor any economic impacts that the system is having on businesses, and I'll report back to Cabinet in early 2022 on this and make recommendations for any further support as is necessary. To be clear about this, if it is deemed that there is further necessary targeted support, it would only be available under the red setting of the new system. As we indicated in October, under orange and green, we will not be providing the widespread economic supports that we have in the past. That is beyond the leave support scheme and the short-term absence payment. On those, I can confirm that they will be available to support those who need to self-isolate, including when waiting for test results, as they do now at every level of the new framework. We are refining the system for these payments, including moving to a weekly basis for calculation, reflecting the new isolation periods. Before the end of the year, we will also confirm the support that will be available in the event of any localised lockdowns. As we assess the impact of the framework, we remain aware that there are particular sectors that continue to be impacted by COVID-19. It's worth noting that the Small Business Cashflow Loan Scheme remains in operation, and we are looking again at whether it needs to be tweaked to provide appropriate support going forward. In terms of other support, the $60 million package for business advice and mental health support to help Auckland businesses through this transition period that we announced late last month is being rolled out. And as we have previously stated, if the business advice elements of this package are oversubscribed, we will look to expand it to meet demand. Finally, I want to note that the Activate Tamaki Makaurau website was launched on November 17th, providing information and links to business supports. We have been in discussion with Auckland businesses and their representatives and the Auckland Council about this program, and we will have more to say later in the week about how we can support it. Back to you, Prime Minister.
Thank you, Deputy Prime Minister. I'll now just ask Dr. Bloomfield to join us on the podium for any questions. Jenna, and then Barry, then Jessica.
What hope do red regions have of spending their summer in orange?
The first thing I would point out is that for those districts who are moving into red, it will feel very similar to what they're experiencing now, with the addition of vaccine passes. So very similar levels of protections, but the addition of vaccine passes to, again, give us that extra tool to make sure that we're protecting people now that we have vaccinations in place. We are reviewing in 2 weeks' time, and we will do that in an open-minded way, looking again at whether or not we've seen a lift in vaccination rates, alongside considering all of those other health factors.
The regions that you have in red at the moment include Gisborne and
Yes.
Northland, the home of the festivals. So did you basically just kill Rhythm and Vines?
Ultimately, those decisions will be for those festivals. We recognise that we have set in place settings for the next 2 weeks. If they make a decision that they will be unable to go ahead, it is one of the reasons that we did put in place a transition support regime, knowing that this period is difficult for those festival organisers and knowing that they may need extra support as we go through this transition.
What would be your advice for them looking at the current settings?
Ultimately, I can't make a commercial decision, but what we have been able to do is give them the best possible chance to push out that decision making and offer them some support for costs that cannot be recovered.
Yeah, but the uncertainty of that 2 week check-in, I guess,
And
is quite hard for them.
The entire reason that we set up that transition support was because we recognised as we move into this framework over summer, there would be uncertainty. There will be some a little further out that will be able to see the pathway for them. There are festivals in the south that will, for instance, be able to go ahead. But in some regions, we are in a transition where there is uncertainty, and that's what that support mechanism is all about.
Prime Minister,
Barry,
a number of the areas that are going into traffic light red have no COVID at all.
Yeah.
Do you have a message for those people who may be frustrated in those areas?
I don't think that the regions that are moving will necessarily be surprised. We have indicated very strongly that one of the central decision-making factors for us would be vaccination rates. Because as you can see, yes, there will be regions that are free of COVID now, but we are seeing the odd case being seeded despite all the protections that are in place. So these are preventative measures. We've indicated that as we step into the new framework, ease the Auckland boundary, we will be making decisions that are very cautious through that period.
The police being laid on to monitor these regions that are in traffic light red now.
It's a very important point to make here is that there are no hard borders with the exception of the Auckland boundary. So as you know, that changes through December. Requirements around testing and vaccination for those exiting Auckland stay in place till the middle of January. But other than that, there are no hard borders in this traffic light system. And so people will be moving. As for enforcement and compliance, yes, we want to make sure that we're supporting businesses as they check vaccine passes and so on, but it'll be different to the border-based compliance you've seen so far.
No need to police it.
No, that's not what I'm saying. I'm saying the policing will be around supporting compliance at venues, ensuring that they are able to operate the vaccine pass checks safely. It won't be congregating around borders because the border that still exists is the Auckland one. There aren't others.
Prime Minister, you say you're taking a cautious and careful approach. Is that fair, though, given how vaccinated we are and where we are? You know, we're almost 2 years in dealing with this now.
I think one of the advantages that we have as a country is that, by and large, we do have quite good spread of our vaccine uptake. You can see how critical that is when you look overseas. In some places, it may look like they have high vaccination rates, but if you have even one region where it really dips a bit lower, that runs the risk of seeing outbreaks. We want to continue to drive up the level of vaccine we have right across the country to reduce the risk of outbreaks. This new COVID protection framework, its use of vaccine passes, will actually help us lift vaccine rates as well as help protect us.
Are you concerned, though, that you'll be creating a divide where you've got a whole region held back by a few pockets of people who don't want to get vaccinated, and is that concerning?
With the exception of Auckland, at the moment, the whole country is in level 2. On Friday, those regions that move to red, it will feel very similar, except now with vaccine passes. So those vaccine passes add extra protection, but the idea of it being heavily restricted, I really push back on. For the most part, people in red will have a very similar feeling to they do now.
Minister, are you able to give us
So I'll just canvass around.
Can you speak
Yeah, I'll
to
come to,
potential vulnerabilities?
yeah, Jane.
Potential vulnerabilities, please, in the different shift to home isolation, for example. So a couple of cases, someone travelling on a flight to get to Christchurch and then testing positive, but also the report with people, isolating at home and critical of about preventable deaths. Can you just talk people through what the difference is going to look like and what support they're going to have in this new
So
sort of
I'll
framework?
cast forward to the arrangements if someone finds themselves infected with COVID-19 away from their home. And then I'll ask Dr. Bloomfield to speak to some of the general questions that you've put. And so for the most part, even if someone is found to have COVID-19 away from their usual place of residence, for the most part, people will have a place that they can isolate. Regardless, a public health unit will talk with that individual and work through whether or not they can continue to isolate in the place that they are currently resident in at that time. If they need extra supports to isolate somewhere else, a public health unit is able to work that through with them. Dr. Bloomfield?
So 2 things to add to that. The first is you referred to the case we've got in Christchurch where this was actually a whānau that had finished their 7 days in managed isolation and were completing the self-isolation at home, and on day 9 one of them returned a positive test. Remember, for all domestic travel in the country, air travel, there are already a number of precautions in place, including mask use, and of course from mid-December, the requirement for everybody to be fully vaccinated or have been tested. So there's a high level of protection for people on those flights anyway, so we're not worried about it, a high risk there from people moving around. The second is, what can people expect when they're being looked after in or self-isolating at home? And yes, you referred to the report that's been released today, and just to add to the apology that's already been made, that actually, and to reiterate that, and what it's shown is ways that we can improve the system, and that has already happened. But secondly, the report, which was very good, refers to the fact that our information systems across different parts of the health system do not link up. Now, I've worked 30 years in the health system, and that's been a holy grail to make that happening. And one of the things that is happening to support managed isolation in a home setting or isolation at home is that these information systems are being linked up across primary care, hospital, health line, and so on, so that whoever is doing the check-in with people has access to all the relevant information, and that's a huge improvement on the system.
Do you think people are ready for a much more light touch, I suppose, from public health, as there are more cases out there, people isolating at home without that direct contact? Do you think people are aware of that and are ready for that, along with more COVID cases actually in the community? Yes. And potentially people travelling around while positive?
So let me be clear, there will still be regular contact from either Healthline or from Public Health. Likewise, as is happening now where we're seeing cases in the regions outside of Auckland, there is very active follow-up, contact tracing, isolation and support of people.
Jane, just on the idea of people moving around whilst positive, before they exit MIQ, they have to return a negative test. So that, I think, is really critical to point out, that on exit people are returning negative tests.
Community cases, you said that, for example, if someone was positive away from home, there'd be a discussion. But
or when I say a discussion, that does not mean that someone's going to take a flight to go back to their home. Of course not. But if someone is isolating in a place which is not fit for purpose, then there would be a discussion around whether or not they can safely relocate to another place without exposing others. I would disagree about the idea of light touch. We are still maintaining a minimise and protect. We don't have a tolerance of COVID in our community. It is why we still are isolating close contacts. It's why we're still having household contacts remain at home. It's why we're still cautious at our border. We are maintaining some of those core fundamental tools that will reduce people's potential exposure to COVID-19.
Can
I'll just-
I get a quick follow on that? Dr. Bloomfield, 2 weeks ago you said that the home isolation program was, quote, working well. Why did you tell the public that when a review into 2 deaths paints a very worrying picture about poor and delayed clinical oversight?
In fact, the report also reiterates that for many people, the system has been working well and continues to improve. The reason the review was done was because there had been these two deaths of people who were isolating at home alone. This is very appropriate. We do this in hospitals. For every death in hospital, there's a review to see what can be learnt, what improvements can be made. In this case, it was identified that there were slip-ups in the system and things that could have been done better, and that the deaths were potentially preventable. Improvements have been made so that the system is working even better for people.
Slip-up, wouldn't you say? Preventable deaths, potentially.
As I said, the report found that the deaths were potentially preventable, and the point of doing the review was to find out exactly where were the areas that needed to be strengthened and improved, and those improvements have been put in place.
Oh, sorry, I'll come Luke, then Jason, then Henry.
Prime Minister, when you announced a couple of weeks ago that today we'll be learning about the new settings,
Yep.
You said you would outline some of the conditions around when parts of the country could go into green. I was hoping you'd give us some details.
Yeah, and so look, we obviously we've said that through this transition period, we don't have an expectation that parts of the country will be in green. And that's because we are in a stage where we're seeing over a period, cautiously, a change in the way that the Auckland boundary will work, a shift into the new framework, and some changes to our other settings. So we want to step through that cautiously. In the same way that previously when we've had changes, we've made sure that we have public health settings in the rest of the country that act preventatively, that in case we have cases there, we're in the best possible position to manage them. That's the reason that we will have all parts of the country either in orange or red through that period.
I understand.
In terms of beyond that, it will be the same
criteria.
criteria that I've set out. We'll be looking at the transmission of any given outbreak at any given time, the pressure on the public health system, our ability to continue to contact trace successfully, any pressure on the hospital system from those cases, and of course ongoing surveillance of vaccination rates, although once you reach those rates then obviously you expect them to only get better.
So for example, if the South Island continues to have not many cases when you're checking in again,
Yep.
January 17, there's a
Yeah.
handful of cases down there, would they be looking
They're
at
doing
green?
everything right. The issue for the South Island is less about what they have done or their circumstances and more about the fact that the country is transitioning right now. And through that transition, we need to make sure that we're cautious.
I get that, but what I'm trying to get at is at what point can people have a...
The
have a
point I'm
sense that
making
they
is
might
that,
go green?
as I've said, the way we've applied the criteria in these initial decisions is different. So, in fact, the South Island has done exactly what they need to. It's more the fact that we're transitioning into the new framework that is the reason that they are in orange, and over time we would likely see that change. I think I said Jason and then Henry, didn't
To
I?
be quite clear, are you telling New Zealand that there's going to be no one in green before the New Year's?
Yeah, we're saying over the summer period through this transition, because keep in mind, the Auckland boundary only lifts in the middle of December. So we do expect that the country will either be in orange or red settings through that period.
Can you explain the Cabinet's rationale in terms of what might happen for a region to go the other way, for example, to go from orange back to red? Is that something that can happen, and what would need to happen for...
Yes, I mean, I don't see that in the next 2 weeks that would be likely, because of course vaccination rates won't go backwards. But the thing that would be a factor for us is if we saw, for instance, an outbreak that was growing at a rate that looked like it may potentially put pressure on contact tracing on our hospital or healthcare system and so on.
And also, finally, on the Waikato, that's from the graph that you've sent out, that is in the orange setting, or it will be. There are still confirmed cases within the community in that region. Could you explain your rationale?
Correct. But actually what this framework does at Orange is put greater protections in place by using vaccine passes. So it's actually a greater level of protection than necessarily what you are seeing now. And they have been operating at quite some time, keeping in check an outbreak that continues to be linked. It just happens to have a long tail. Equally, you can see that the vaccination rates are really solid in that region as well. I said that I would come to Henry.
Due to the 7 days double vaccination rates for 12 plus. You're talking about those.
For many of those
red.
districts, that's right.
Relatively is the highest, 78 double doses. Are you saying that basically if they reach 80, it's probably orange, given there's no cases there, if things can remain stable as they are? And also, some South Island areas are below that. Westland is below that. So
Yeah.
is it the distance that gives them the...
So two things there. Firstly, whilst vaccination has been a significant factor, but not the only one. And what I would say about the South Island is, yes, there are pockets of the South Island in some districts that have had slightly lower rates, keeping in mind that my recollection is for the West Coast are some 500 doses shy of hitting some of their targets for first doses. So their population base, obviously being smaller, has an impact there. But the other factor to keep in mind is that for the movement across the country, we have the ability to check every single person is either double vaccinated or tested before they're going into the South Island. So we've factored that in as well. Yeah, I'll let you finish.
The 70s range, basically.
As I've said, that is... As I've said, it's one of the factors, and it has been a significant one for this first decision. It won't be the only one as we go into after that next 2 weeks. But for those parts of the country that do want to see a setting change before before Christmas, then I would encourage everyone to work really hard on vaccination rates.
So how concerned are
Yeah,
you?
Jenna and then
Omicron?
Jessica, and then I'll come back over here.
How concerned are you if Omicron does get into New Zealand, and what further
Sorry,
restrictions? would
Tova,
you
not Jenna.
Same. And what further restrictions would you like to see in place to stop that from happening?
Well, I think the first thing to say is we're doing what we've done right through the pandemic, and that is try to keep the virus out as much as possible to give us time to learn more. And WHO put out an update today, which I could characterise as saying we don't really know much about this virus. But the important thing is, and as the PM mentioned earlier on, that by far the dominant circulating variant globally, and certainly our outbreak here in New Zealand, is Delta. And we know that the vaccine, our current vaccine, is highly effective against that. So what we're looking at first is just whether there's anything else we should be doing at the border to help reduce the likelihood we get Omicron across the border in the near term. And we've already put in place some additional measures. That is, anyone coming from those 9 countries, it's a 14-day managed isolation period. Anyone who has left managed isolation and is in the community who may have come from those countries, we are contacting right at the moment, and they will be doing a further 7 rather than 3 days in the community with a day 12 test. So it's really just looking to keep it out while we learn more about it, including its transmissibility, the impact it has on severity of disease, and also quite rapidly we should know within a week or two from lab studies the effect of the vaccine on this strain.
What are some of those other things that you're looking at doing around the border?
Oh, just to see whether there is anything else we would do at the border routinely, given that we're already seeing a growing number of countries where the Omicron variant has been found, including Australia, as you're aware, whether there's any change to the current length of stay and the testing regime. At this stage, we're not advising anything in particular, but we'll keep that under advisement.
I think I heard Jessica.
Are you aware of concerns from home care workers and support workers who are being supplied food-grade gloves to use as PPE?
No, I'm not aware of that, and I'd be surprised because we have an incredibly good supply of gloves here in our PPE stores, so I'm happy to follow that up and see if that's an issue.
So there's absolutely no shortage of medical-grade gloves. The PPE supply is all good?
That's my understanding, yes. We have a very good supply of gloves.
And Prime Minister, with the flights for Omicron, the WHO is recommending that we shouldn't be cancelling flights because it's a blunt tool. Do you stand by our cancellation of flights to the lower part of Africa?
We've been totally consistent all the way through this pandemic. We have always used our borders as a means of protection, and we will continue to do so. The World Health Organization has consistently taken a different view, but we've found that the ability to use quarantine at our borders, as we have in place now, is proving vital for COVID management, particularly as we see this new variant emerge. Okay, so, yes, sorry, in the front.
Did the emergence of Omicron influence any of the decisions you made around the traffic light system?
No, because actually, as we've consistently said, in many ways it adds a greater level of protection through the use of vaccine passes. So yes, the alert level system has served us really well, but now we want to continue to use the tools we have and the vaccine pass in addition to that. The commentary I've seen from scientists in particular has been that whilst we are undertaking work to better understand the impact of Omicron, the things that are fundamental are things like mask use, contact tracing, isolation of cases, all the things that we have been doing to date and will continue to do under this framework.
And some countries are cancelling travellers more broadly than from Southern Africa. Is that something that you're considering at this point?
In many cases, that will be countries that won't necessarily have the kinds of protections we have. We put people through a managed isolation system and we test them rigorously while they're there. So that won't be something that operates in all countries, and so the quickest thing for many of them would be to simply close down the borders. Keep in mind that we will continue to review whether or not any other countries need to be added to our very high risk country list as well.
Minister
Mark.
Robertson.
Dr. Bloomfield, does the sort of emergence of this Omicron variant underscore the need for sort of vaccine equity around the world, and Prime Minister as well? Are you disappointed to see the TRIPS waiver process still being held up by developed countries in Europe and the UK?
On your first question, yes, it's very important that as part of the global pandemic response, that countries that can afford to support vaccine availability in low-income countries, and that's certainly been a key part of our advice to government about donations, and it's been, and we've also provided, of course, direct support to a number of Pacific countries, not just with vaccines, but direct support to help with the vaccination programs. It does reiterate this because the best way to prevent the development or the emergence of these variants is to reduce the amount of infection there is globally. So it reiterates the point.
On the 12th ministerial meeting in Geneva, yes, a shame to see that cancelled, but you can also understand the circumstances under which it has been. I think that the world has two challenges that we must meet. Firstly, equitable vaccine distribution, absolutely. But at the same time, support for the distribution in country and support in whatever way we can to overcome hesitancy. In some cases, countries have had limited access, and others have had access, but the ability to distribute and then have the receipt of those vaccines welcomed has been challenging. Now, we won't have all the answers there. You have to have a good understanding of a population to know what the answer is there, but I do think that is one of the challenges.
It's been 6 months since both the US and New Zealand came out in favour of that TRIPS waiver process for the vaccine. Has the government and have you been pushing the holdouts in the EU to come around on this issue?
Our particular focus for us actually in the past few months has been ensuring the smooth movement at the border of vaccinations as they stand while we're being APEC chair. So making sure that we remove tariffs on and any restrictions that may exist on vaccines and vaccine consumables. And we've done that successfully, at the same time supporting the wider work of TRIPS. The next challenge as well will be making sure that we have wide access to antivirals. Because in those countries, perhaps where they see hesitancy, they may see greater uptake of treatment, and we need to ensure that is equitable as well. So I might just, Trevor, if I can, just go to those who haven't had a question yet. Michael, down the back in here. Yep. Sorry, who hasn't? Oh, Minister Robertson.
I've got lots of questions.
Yeah. Sorry, I had, what did I say? Forgive me. John, Michael, yeah, and then in the front, yeah.
Prime Minister, in Auckland, the fatal shooting today in Glen Eden, have you spoken to police about this, and are you concerned that police have lost control of law enforcement in Auckland?
No, I do not hold that latter concern. I have not had a chance to be briefed on the incident in Auckland yet as a result of cabinet meetings throughout the afternoon, but I do intend to touch base with the police minister.
Are you concerned about the spate of recent shootings, particularly in parts of West Auckland?
Look, what I would say is that, of course, we have taken direct action to try and reduce down the access and nature of firearms that are being accessed in the wider community. So you'll see that we've moved on licensing. We've removed those weapons that are military style and for the most part, when in the hands of the criminal fraternity, are designed to cause, mass devastation. We have taken action on firearms. We will continue to do so. The efforts of police have also been very focused on the seizure of both firearms and criminal assets through a number of operations that have been very successful. And we will continue to support them to do that work. Sorry, I said Michael, and then I'd come down the back and then.
In Auckland specifically, what things are you looking for to move the city to the orange setting, and do you see that happening at all?
Because you'll see very solid rates of vaccination in Auckland. They've done an incredible job. For them, it turns more to outbreak and just the ongoing outbreak management. So that's what we'll be looking to.
Certain case numbers or...
Yeah, just whether or not we have seen what has been described to me by modellers as at least a plateauing, which is really positive. I think we'd really want to see that really bed in. Perhaps, Dr. Bloomfield, you might like to comment on what we're seeing in the outbreak in Auckland.
Yes, just to add to that, we have certainly seen that plateauing of cases and hospitalisations, which is good. And it will be interesting to see over this next couple of weeks as Auckland moves into the red setting, which of course does, compared with the current setting, creates more, opens more things up, including hospitality, but with the use of vaccine passes. So we've seen this plateauing in the situation where Auckland moved from level 3.1 to 3.2. So it's a good sign, and it really does reflect the high vaccination rates, and we'll be looking to see that plateauing continue and hopefully a decline in cases, and that would be a good signal the outbreak's well under control.
Do you expect that to happen with the move to the red settings, that the cases will continue to plateau and decline, or what is your modelling show?
General sense has been that the easing thus far hasn't contributed to.
That's right. So the modelling now, well, it's hard to predict exactly what will happen, but again, the key influence that's happening here is those high vaccination rates, and those are still going up, not down, day by day. And of course, from today, we've started the booster program as well, so that brings in especially those healthcare staff, border staff, who among the first people vaccinated were those in Auckland, so they can now get that booster just to really get that increase in immunity for those individuals.
I'm going to come here, and then I'm going to come to questions for Minister Robertson.
Thank you. Thank you, Prime Minister. Question for you and Dr. Bloomfield.
Yes.
So just on the home isolation deaths, the review of those deaths, are you now confident there won't be any more potentially preventable deaths, and that the failings in the review, IT issues, overloaded systems, etc., have all been fixed and they're not going to happen again?
So the work on the information systems is continuing. The processes for handover between agencies are much stronger. At the moment, there are really good workarounds while the information systems are being linked up. Our intention is, of course, to prevent avoidable deaths in the community, indeed in any healthcare setting. I'm confident the system is much stronger, and one of the recommendations that is being implemented, of course, is to put a clinical governance group across the top of that whole